A sea of white coats at the White House lawn yesterday as President Obama invited more than 100 doctors to promote his health care plan. Here is part of the pitch you heard on Monday.
Every one of you here today took an oath when you entered the medical profession. It was not an oath that you would spend a lot of time on the phone with insurance companies. It was not an oath that you would have to turn away patients who you know could use your help. You did not devote your lives to be bean counters or paper pushers. You took an oath so that you could heal people. You did it so you could save lives. The reforms we're proposing to our healthcare system will help you live up to that oath.
All right, that was part of the message. Turns out some of the doctors say they had no idea why they were invited. And were some of the docs at the event not on board with the president's health care plan? Catherine Sirks has been doing some digging on this. She's the Director of Policy and Public Affairs at the Association of American Physicians and Surgeons, and she's my guest out of D.C. Good morning to you.
Good morning. You know what, I want to start out. The president, we do agree with the president that doctors shouldn't be insurance billing clerks and they shouldn't be refusing patients. But you know, it's government that makes them spend out the most regulatory time and paperwork, and it's government that tells them that they can't, for example, treat Medicare patients for free.
So just so I understand it, you have some agreement on the first part of your answer, but the second part of your answer has to do with, well, I guess the amount of time that a doctor spends with a patient, which is really the crux of the issue for a lot of doctors. Listen, you told our producers you were going to the White House yesterday to talk to some of the doctors who went there. Did you meet any of them?
Yeah, we met a lot of them. And for example, one of our members was invited who is a very outspoken critic of the president. In fact, he's run the state initiative in Arizona to ban a mandate, an individual insurance mandate. He was invited, and he said in good conscience he couldn't stand up there when he was told he would be there to support the president. I talked to some other folks, for example, who are single-payer supporters. They completely disagree with the president, and in a letter that they brought with them, they talk about how the Senate Finance Plan, the Baucus plan, is an insurance industry plan that they would never support.
So, but they still went to the event, is that right, Catherine?
But they still went to the event. They thought that perhaps they could talk to the president. But the president, of course, billed this as doctors supporting him, which isn't really accurate. He might as well have had his, I said he might as well have had his ringmaster hat on as he made them jump through their hoops looking like a dog and pony show.
What you also told our producers that it did not look like the White House, these are years of words, I believe, tried very hard to find a variety of doctors. How do you know that?
Well, as it turns out, that many of the doctors that I spoke with were actually contacted by a group called Doctors for America. And Doctors for America is also part of the Healthcare for All Now movement, and which is also tied in with the union group. So they were contacted by that group.
That's Doctors for America. I just want to make sure.
That's right.
Okay, now we've got some videotape.
Doctors for America.
Hang on. I don't want to get too far out there, okay? We'll keep it on one thing at a time here. Apparently, yesterday they provided coats for some of the doctors who did not show up with a white coat. Are you aware of that? There's some videotape that shows that now.
Yeah, I heard about that, and then they had meetings before, and then they had a meeting afterwards at their offices. So and as I said, almost every one of the doctors that I talked to, except for the single-payer folks, actually were contacted by Doctors for America and asked to appear.
Okay. How do they think that went yesterday? I mean, were they happy with it? Did they have a chance to express their views to the president?
No, there was not discussion. They did not have a chance to talk with the president, other than a couple of them were able to meet them. They were obviously there as props. The doctors are being props, and what we're saying is that, you know, this is just shameful that the White House is trying to manipulate doctors at this point. The president's been vilifying doctors up until now, talking about removing legs and tonsils for money, and now when it's in crunch time, he feels that he needs the doctors, so he's coming out and using them as his props at the White House.
That's strong language. You call these doctors props.
Oh, sure. We had 1,000 people, 1,000 doctors and supporters over at the Capitol on September 10th who opposed who oppose government involvement in medicine. If he really wanted to hear what we had to say, he would have taken our requests for White House meetings. He would have come over to hear what they had to say. He's not open. He's showing that he's not open
Wow.
to what doctors have to say. He's
we
looking
heard-
for arranged photo ops.
We heard from the White House yesterday. Catherine Sirks with The Other View today. Thank you for your time in Washington.